thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Acting Mayor of the City of London, Josh Morgan, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, the Executive Vice President and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie, and the Warden of Middlesex County, Alison Warwick. Also happy to have you along with us this afternoon as members of the media. And as always, you're welcome to ask your questions. And we've only got a couple in the queue right now. So if you do have questions, don't wait today. Get those questions in as soon as you can, and do so by clicking on the question mark inside the text bubble here on Microsoft Teams. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are watching on the CTV London website. Let's begin with our opening remarks. And today we'll start with Acting Mayor Josh Morgan.
Great, thanks, Dan. And as we know, the provincial masking regulations are lifting for most indoor settings, with a few exceptions, including public transit, healthcare, long-term care, and high-risk congregate settings. As a municipality, we've been aligned with all of the provincial regulations throughout the pandemic. So, with the exception of Dearness Home, the requirement for masks will be lifted for the public in city facilities as of March 21st. We recognize that members of the public may wish to continue wearing masks inside city facilities. Although there may not be a formal requirement, we have always encouraged people to follow the advice of our local medical officer of health. He is our public health expert who understands the changing local conditions. As we move forward together, we will also continue to encourage kindness and respect for others and the choices they make. I personally will still be wearing a mask and following Dr. Summers' advice in most indoor settings. This week, we also have St. Patrick's Day, and I expect there will be many people looking to celebrate throughout the day on Thursday. We will be encouraging everyone to celebrate responsibly and ask that people make sure they take steps to take care of themselves, take care of each other, and take care of the community. Well, many of the restrictions have started to lift, and more will lift in the near future. COVID-19 remains present in our community. We'd ask that people keep that in mind as they celebrate, and please follow all of the remaining health restrictions. Be careful, care for each other, and make good decisions. That's all I have for today, so I will turn it over to Warden Warwick.
Madam Warden, I believe your microphone is on mute. Madam Warden, your microphone is on mute. There we go.
There we go. Can you hear me?
Yes, we can.
Yeah, I don't know what's going on out here in the world today, but things are, as usual. Magnetic fields around me that aren't cooperating. Anyway, good afternoon, everyone. There's not really anything recent to report from the county regarding COVID-related issues. I'd like to take this time to update you on some other activities happening in this county this week. Our libraries are open and have lots of activities planned during March break. Most of the 15 branches are operating 10 a.m. to 8 a.m. The staff are all looking forward to your visits. For more information about your local branch's hours, you can learn more at library.middlesex.ca. Friday, March 18th is Public Transit Appreciation Day. The County of Middlesex has 2 different routes to offer, as well as connections to Grand Bend that are available leaving at Masonville Mall. On Friday, there's no charge for riding the bus on the Appreciation Day. I encourage you to hop on one of our buses or on one of our Southwest Community Transit routes. If you've ever wanted to try out one of these routes, now is your chance. Friday, I will be hopping on one of our buses and trying out the Perth County route that leaves Masonville and takes us to St. Mary's in Stratford. To celebrate Public Transit Appreciation Day, I'll find a nice place for lunch and then I'll return on the same day. Our community transit buses are now set up to take electronic payments, so no cash is necessary. If you want to explore Middlesex or other neighboring counties, this is a great and economical way to do it. If you're curious about routes and schedules, just go to middlesex.ca and look at the Middlesex Connects page. I will take this opportunity and wish everyone a happy St. Patrick's Day in advance. Enjoy your week, stay healthy. I know I've said this before, but please be positive and stay negative. Thank you, everyone.
Thank you, Warden Warwick, Acting Mayor Morgan, for being with us this afternoon, and to the media joining us as well. The Middlesex-London Health Unit is reporting 55 COVID cases today and no additional COVID-19 related deaths. Over the weekend, we had 80 additional COVID cases reported on Saturday and 66 additional COVID cases reported this past Sunday. There have been no COVID-19 related deaths reported since last Friday. Over 32,000, nearly 33,000 COVID-19 cases have now been identified in the London and Middlesex region since the beginning of the pandemic. The number of COVID-19 related death remains at 352. Over the last 2 weeks, case counts are no longer declining. They have plateaued, and the 7-day average is increasing slightly. As public health protections continue to scale back and people increase their number of social contacts, the transmission of COVID-19 in our community will increase. And as you know, the province is lifting masking requirements in many settings, including schools, as of March 21st. The risk of COVID-19 in our community, however, remains high. The symptoms that individuals will experience if they're infected with COVID-19 may be mild, particularly if they are vaccinated, but they may still find themselves quite sick if they do get COVID-19. Fortunately, there are still numerous tools in our toolbox that can help us to protect ourselves. The Middlesex-London Health Unit and I continue to recommend that individuals wear a mask and remain respectful of others, whether they choose to wear a mask themselves or not, after March 21st. And as a reminder, there are notable exceptions where masking will still be required, including public transit, healthcare settings, long-term care homes, retirement homes, and other congregate settings. I also strongly recommend that all individuals who are eligible receive their recommended doses of COVID-19 vaccine. Everyone 12 years of age and older is now eligible for a booster dose and should get theirs as soon as possible. And of course, stay home if you have any symptoms of COVID-19 or feel unwell. That critical step can help to limit the transmission of COVID-19 in our community and protect those around you. As many of our region kick off their spring break today, there are still things that you can continue to do to make sure that your week remains a safe and healthy one, including the recommendations I just outlined. I want to highlight that if anyone in your family, child or adult, becomes symptomatic with a respiratory illness, it is critical that they stay home. And this may mean canceling activities which you will not want to cancel. Anticipation for camps, spring break activities, travel, those are significant anticipations and activities that we would not want to postpone. However, COVID-19 remains a significant risk, and it is critical that you postpone those activities if you develop any symptoms. There are a number of community hub COVID-19 vaccination clinics running this week at community centers, libraries, and schools across our region, including a clinic that gets underway in just under half an hour at the Kiwanis Senior Center at 78 Riverside Drive, not too far from where I am right now, where the doors will be opening at 2:30 p.m. All of our vaccine clinics at this time are walk-in. No appointment or health card is necessary, although you can visit covidvaccinelm.ca to make an appointment at any of our mass vaccination clinics. As a reminder, there are new hours of operation at our mass vaccination clinics in the next short while, including notably at the Caradoc Community Center in Mount Bridges beginning today. The clinic is now open Monday through Wednesday from 11 a.m. to 6 p.m. We will continue to have expanded mobile clinics throughout our communities over the next many months. We will continue to publicize that calendar as it becomes available. Lastly, this Thursday is St. Patrick's Day, and we know that a lot of people are planning to gather with friends and family after 2 years of not being able to do so. We, of course, support having a good time, but COVID-19 is notably still here, and it is critical that you celebrate safely and responsibly. As much as you're able, try to limit the size of your social gatherings. Given the risk of COVID-19 in our community, this is still not the time for a large indoor gathering. and we still strongly recommend wearing a mask if you're indoors and cannot maintain 6 feet of physical distance from others. There are many resources on our website to help reduce your alcohol-related risks. As a party host, just visit healthunit.com/planningaparty. And we also have a great video explaining Canada's low-risk alcohol drinking guidelines, reminding that COVID-19 isn't the only health risk that's out there this spring break. With that, thanks for joining us. We look forward to taking some questions. I'm going to pass things on to Carol Young-Ritchie from London Health Sciences Centre.
Thank you, Dr. Summers, and good afternoon, everyone. And thanks for having me here to share an update on the COVID-19 situation at London Health Sciences Centre. As of this morning, we are caring for 41 COVID-19 positive inpatients, and we have 5 or fewer patients in critical care. In our children's hospital, we have 5 or fewer inpatients and no patients in our pediatric critical care. We currently have 1 unit on outbreak. Our partners in infection control, as well as our unit staff, are working diligently to end this outbreak as soon as possible. However, this is again a reminder that COVID is very much still in our hospitals. To that end, I'd like to offer those who are enjoying a well-deserved March break a reminder that it's still important that we continue to follow the public health guidelines of getting vaccinated, including a 3rd dose and booster, physical distancing, a mask, and practice proper hand hygiene. Thank you, and I'll send it back to you, Dan.
Thank you very much, Carol, Dr. Summers, Acting Mayor Morgan, and Warden Warwick. Well, we do have a few more questions now, so thank you for submitting those. And again, if you do have a question you'd like to ask one of the folks on the briefing this afternoon, just click on the question mark inside the text bubble, indicating your name as well as your media outlet and who your question is for. All right, let's go to the first question. Dr. Summers, this one is from Jane Sims, and it's for you. And Jane, of course, is from the London Free Press. Dr. Summers, there have been recent case spikes in China and the UK because of the Omicron BA2 variant. Have there been any cases detected in the region? How will the health unit be monitoring its spread when we don't have comprehensive testing?
Thanks so much for that question, Jane. Yes, the BA2 Omicron subvariant is increasing in the proportion of cases identified in Ontario and across the world. However, although we are not doing testing for every COVID-19 individual who has COVID-19 symptoms, there is a selective surveillance process that's in place through the Public Health Ontario laboratory, which looks at the proportion of those that are testing positive who, under whole genome sequencing, show to be the BA2 subvariant. So there is a surveillance system in place, and over the last number of weeks, we continue to see the proportion of cases that are sampled rise that are BA2. If we look back to the week of January 23rd to 29th, 6.3% of those samples which were whole genome sequenced were the BA2 subvariant. Fast tracked to February 13th to 19th, and that was 12.3%. Obviously, we now sit here in mid-March. We're waiting on the most recent surveillance results after the whole genome sequencing, but that proportion is going to continue to go up. The BA2 subvariant is more transmissible than other subvariants of the Omicron strain. So it, over time, will gradually out-compete and become the predominant strain, just like other more transmissible variants have become the predominant strain in our region. What is not yet clear about the BA2 variant is whether or not it has a larger risk of vaccine escape than the original subvariant of Omicron. The transmissibility and infectiousness of Omicron certainly created significant and notable challenges for us when it sprung onto the scene. But what also created significant challenges was the fact that our vaccine, or simply 2 doses of our vaccine, was not as effective as disrupting transmission of symptomatic illness as it was with previous strains like the Delta variant. That, however, may not have changed dramatically between the original Omicron strain and the BA2 subvariant. So its impact on the overall spread within our community remains unclear. It is highly likely that it will become the dominant strain over time, and through Public Health Ontario's laboratories, selective surveillance sampling and whole genome sequencing, we will get a sense of when it becomes that dominant strain. Thanks, Jane.
And thank you for that answer, Dr. Summers. Let's go to another question for you, a follow-up from Jane Sims at the London Free Press. Dr. Summers, only 55 new cases were reported today, which is heartening. However, can you estimate the true number of cases Is the virus still at all-time high levels in the community?
Thanks so much, Jane. I cannot provide an accurate estimate of the absolute number of COVID cases in our region as it stands. Estimates from other provincial authorities have suggested that the case count that we get might be 10% of the total case volumes in the region. However, that has not been validated. What we do know is that what we are reporting is just a subsegment of the total volume of COVID-19 in the region, which is why we notably look at the trends. Certainly, we have seen a significant decline in cases since the peak of Omicron at the end of January. However, if we look at 55 cases today, given the select eligibility criteria for testing, it is absolutely clear that the risk of COVID remains high in our community, and it is likely still higher than it was at any point prior to the Omicron wave. That being said, the protection that people have now from being boosted, vaccinated, or having previous infection is notable. And that's one of the reasons why the province is demonstrating its confidence in rolling back public health protections because of the community immunity we think, or they think, many in our community have, particularly against severe illness that would lead to mortality or admission to hospital. But the risk remains high, and that's why I continue to strongly recommend getting vaccinated and boosted as soon as possible, continuing to wear a mask, and continuing to function as though we are still in the midst of a pandemic. We are clearly shifting from an emergency response to more of a resilience response. However, I think there is still some uncertainty as we continue to spend much of our time indoors with regards to the risk of hospitalization as a population from COVID-19. So continue to play your part to protect yourself and those around you, and we'll continue to monitor things week by week. Thanks, Dan.
Thank you very much, Dr. Summers, as well. We do have one last question, and Dr. Summers, you touched on this in your opening remarks, but I wondered if you could go back a little bit on it and maybe a bit more detail. This question is coming from Sawyer Bogdan at Global News Radio 980 CFPL, and it's about St. Patrick's Day. And with St. Patrick's Day and bars able to be open to full capacity, what are some of those specific pieces of advice you have to Londoners who are looking to celebrate?
Thanks for that question, Sawyer. A few things to note, building on what I've outlined already. The risk of COVID-19 in our community is high. If you attend a bar during the St. Patrick's Day weekend and the bar is full, the probability that someone in that bar is incubating or transmitting COVID-19 is essentially guaranteed. So know that and recognize what you can do to protect yourself, both from getting exposed as well as bringing that home and transmitting it to others. You should continue to wear a mask. You should ensure that you are vaccinated and notably boosted. Anybody who's able to go to a bar is also eligible to get a vaccine. And so make sure that you get out and get boosted. You can be much more confident, frankly, in the safety and efficacy of that vaccine than perhaps the drink that's in your hand. So it is critical that you get vaccinated before attending such an event. And recognize risk is not on or off. There is no such thing as no risk and all risk. It is a continuum. Each of us as individuals tolerates a variety of risks throughout our day. We tolerate risks when we get in our car, when we cross the street, when we go on a trip, and when we go out to celebrate. There are risks that we tolerate. And one of those risks, the St. Patrick's Day, is a varying degree of risk with regards to exposure to COVID-19, knowing, as I mentioned, that someone in that bar will be incubating and transmitting COVID-19. So acknowledge that risk. That may impact whether you go out or not. That may impact your vaccination status. That may impact the mask that you wear. These types of steps are critical in reducing your personal risk and acknowledging that there is no COVID-free zone when we are out and about with others, particularly in indoor environments where close contact is going to happen. We are shifting from that emergency response to a resilience response. We are going to start to do activities which we have not done for a while. And we individually and as a society are going to start to tolerate some of these risks, largely because of the vaccination protection that you get from severe illness from COVID-19 now. And that's what makes this different than even a year ago or 2 years ago. We have protection through the vaccination on the whole from severe outcomes, particularly the younger you are. So consider that this St. Patrick's Day weekend, mindful that obviously laughing with friends and family is so important as well. Thanks for that question, Sawyer. Back to you, Dan.
Thank you very much, Dr. Summers. And with that, that does bring us to the end of our questions for this afternoon's virtual media briefing. Thank you, Dr. Alex Summers, Warden Alison Warwick, Carol Young-Ritchie, and Acting Mayor Josh Morgan, as always, for your insights, for your information, and for sharing your knowledge about the response to COVID-19 that continues in London and Middlesex County. That will do it for today. We'll be back with our next virtual media briefing this coming Thursday. That will be on St. Patrick's Day, March 13th at 2 p.m. And just a reminder to let you know that we are going to be shifting how these virtual media briefings are timed. This will be our last week that we are doing a Monday and Thursday virtual media briefing. We'll be moving to once a week starting next week, which will be the 21st of March. So there will be details and a bit more of an announcement coming later on this week. That will do it for today. Thank you once again for joining us. Have a great rest of your Monday afternoon, and so long for now.